Welcome, Sonia. Sonia, would you like to introduce yourself?
Thanks, Shania, for inviting me. My name is Sonia Street. I'm a psychologist from Melbourne, Victoria, and I work predominantly with children under the age of 7. I got my qualifications through the University of Queensland and through Monash University, and I've worked for over 30 years with children predominantly on the autism spectrum.
Thank you, Sonia. And there's a worldwide trend or increasing trend of recognizing neurodiversity as a strengths-based condition so that we can empower our young ones, especially if we recognize the signs and symptoms early. We empower our young ones with all the right tools so that these neurodiverse conditions can be used to their benefit. You build on their strengths. There's a good saying, isn't it? If you ask a fish to climb a tree, it ain't gonna happen. But if you give fish water, you won't have any problem. So I suppose it is about allowing our children the right opportunities by identifying their strengths early on and where we can give them a little bit more help. And that's how I see neurodiverse conditions, right, Sonia? And I think there's an increasing recognition of that. So with so much experience, you told me 30 years of experience, right? With so much experience, would you like to tell us about the early signs that parents can look out for in their children if their child does have autism or traits of autism?
I'm really focusing here on early childhood, so children that are predominantly still speaking in single words and phrase speech. So in children of that age, what we're looking for is their ability to interact both with familiar and unfamiliar people, their willingness to play and play with a variety of toys. We're looking for their interest in engaging with other people in their play, how they show people things, what they give to people, and how they're starting to share, those very earliest signs. We're also looking for behaviours of concern, things that might be highly repetitive, highly restricted, or very unusual for their age. So these are the earliest onset signs. And amazingly, these days, we can identify reliably with the tools that we have from about 18 months onwards in most cases.
It's difficult being a parent. I'm a parent, although my child is quite old now, but I was telling you a story earlier, right, Sonia, that when our kids are not if you feel they are different from peers, be it physical or mental health conditions, or they are in distress or something is not going the way we expect it to go, the distress in parents is often quite a lot, and they often feel quite vulnerable. There's a lot of blame, shame, guilt, and all sorts of mixed emotions that parents feel when something like that, even if they recognize. How do you think parents should approach professionals so that they get the right help?
It's a really good question. So more often than not, when parents are seeing me for the first time, you're absolutely right. They feel a sense of shame, sense of guilt, often terrible sense of worry that somehow their parenting has contributed to their child's behaviour. So they come in with very mixed emotions, but often also we know there is good research available that shows that 4 out of 5 times when children have difficulties, it's the parent that identifies first. Sadly though, we find that many of those parents, their experience of telling a professional, they're often told the first time that there's nothing wrong. So our take-home message for this, for parents watching, is that you will need to expect to persist. It might be that you have to raise concerns several times and stick to it. I think the important thing here though is that parents do know their children and they can trust that knowledge that they have, which might bring us then to how best to engage with services.
Yes, how best to engage with services.
Well, as a psychologist of many years, I'm a big fan of something called family-centered practice, and we have many decades of research to support its use and and shows how effective it is, and that we see much better outcomes for children and their families when we take this approach. So for families seeking these services, this is good to know. We define family-centered practice in its simplest of forms as When you're in the room with your child and a clinician, the expert in the room is the parent, not the clinician. And I liken this to being in a bit of an orchestra. So I am in the orchestra as a musician. I have to play, but I'm led by the conductor, who is that parent. It's parents who set the goals, the expectations, and bring that knowledge. We want, whenever possible, to surround children with a team, that orchestra again, and that orchestra have different people in it, and they do have different functions. But it means then that families are given the best information to add to their knowledge so that they make great decisions for their child.
That's fantastic. So again, that brings us very neatly to top tips, Sonia. What, maybe 3 or 5 top tips as to what to take away from this.
Well, for your viewers, you'll need to check what autism specific services are closest to you and what those referral pathways look like. Different regions will have different expectations and different rules. Where I'm from, it might be that there might be only one person that needs to make a diagnostic assessment, but it might be that there's several people involved. So find out close to you what you need. When you get there, remember, persist. You may need to raise your concerns several times. Trust your own knowledge. That's a very top tip. You know your child better than anyone else. And find those professionals then that are going to work alongside with you and respect that knowledge as well. Form that team around your child if that's possible. And that can be hard early on, but I really encourage families to stick at that and find that sense of who's going to be the best person in my team for my child.
That's really powerful. And I would add to it that view it with a strengths-based lens. There are lots of strengths in autism: the ability to cross the T's and dot the I's, the ability to focus on things, the ability to stick to rules, protocols. There's a lot in there, a lot of strengths in there. It's not a vulnerability. And if parents are happy and feel strong, they can provide that strong, nurturing environment for the child to see the neurodiversity as a strength as opposed to as a weakness. That would be my take home as well.
I have to add, I feel so blessed to have worked with so many amazing families and so many of their amazing children who have taught me so much over so many years, and I feel absolutely humbled and grateful for those opportunities every time they come along. So we hope that you can gain something to grab hold of in a time where there is a lot of worry and a lot of stress for most families. But hang on to that knowledge and hang on to those hopes and dreams that you have for your children.
Wow. Thank you so much, Sonia. That was wonderful. Thank you so much for being on the channel. And as usual, if you have learned something useful, subscribe to my channel, like it, share it, tell it to all the people you know. Thank you for watching.